The good news first. All indicators point to India having got over the COVID peak. The daily numbers are showing a stable to slowing trend. But what awaits us after we get over this physical ailment? Geometric View takes a look at the bigger and longer lasting pandemic that's around the corner. Mental illnesses. It was earlier this month that we marked the World Mental Health Day. For the last 20 years, we have taken pride and the world has envied India's demographic dividend. DD or demographic dividend is the growth potential associated with young populations. Even today, India has roughly 700 million under the age of 27, which is absolutely mouth-watering for any nation. But that is provided we are able to give them jobs and we have a growing economy. Neither situation seems to exist now. We have about 15 million young men and women coming into the job market this year and for several years from now on. But jobs seem to have vanished into thin air. And India's ultra-stringent and unimaginative lockdown has meant that their hopes have been dashed to pieces. Therefore, the bad news. Our demographic dividend is in grave danger of turning into a demographic disaster, featuring legions of unemployed youth. In the COVID backdrop, a different DD may be evolving for India, namely depression and diabetes. Speaking to graduating students of the National Institute of Mental Health and Neurosciences, NIMHANS, in Bengaluru in 2017, President Ramnath Kovind said, and I quote, "India does not simply have a mental health challenge, it is facing a possible mental health epidemic." He was only a few months into his presidency then. How could he foresee it then? Absolutely prescient. What he could predict then is upon us now in explosive fashion, a pandemic of mental illnesses. The World Health Organization has found India to be the most depressed country in the whole world, followed by China and the US, if that makes us a little less depressed. And these three countries, India, China and the US, lead the world in anxiety, schizophrenia and bipolar disorder. To get a global picture of the crisis, I spoke to Dr. Roy Abraham Kallivailil, the Secretary General of the World Psychiatric Association. From 2014 to 2020, he remitted office only a fortnight back, and he was the first Asian to head the WPA. You're the first Asian to be the Secretary General of the World Psychiatry Association. What is the global picture about how the mental illnesses have been since the outbreak of COVID?
Globally, WHO has alerted all countries that mental health should be one of our top priorities. Recently, WHO conducted a survey and the results have come about 2 weeks back. And the main finding of the survey that there is disruption in critical mental health services in 93% of the 130 countries which are surveyed.
Cutting across various age groups, people have developed various phobias about COVID-19 and are struggling to come to terms with the new normal, says Dr. Thomas John, the Kerala State President of the Indian Psychiatric Society.
During this COVID time, people of all ages, children, adolescents, adults, and even elderly people, they all get scared because it's a new thing. And they find it difficult to adjust to the new normal way of life. So naturally there is a lot of mental health stress and mental health issues related to the COVID. Even though it is a physical illness, the impact on the mental health is unimaginable.
The situation is alarming, but what is disturbing is that India's mental health statistics are almost non-existent. We still have to go by the findings of a survey done by NIMHANS during 2014-16 for the Federal Health Ministry. That survey had found that 10.6% of all Indians had some mental morbidity, and the treatment gap was between 28% to 83% for various mental disorders. One positive step that India has taken in recent years is the enactment of the National Mental Health Care Act 2017, which has included mental health for insurance coverage. But on the ground, things are not very rosy. It costs about 800 rupees to 2,500 rupees for a single session of counseling in most major metros in the country, which is unaffordable for a large majority of the people. And the low doctor-patient ratio for mental illnesses is downright frightening. How well is India prepared to combat the COVID-induced stress and mental illnesses?
I would say that India is not at all prepared. In India, for example, we have only 6,000 psychiatrists for 1.4 billion population. The barest minimum which WHO recommends is one psychiatrist for 100,000 people, which means we should have at least 14,000 psychiatrists, which may take a century or one or two centuries at this level to reach that figure.
You're saying India has only 6,000 psychiatrists?
Yes, only 6,000 psychiatrists, and the number of clinical psychologists, psychiatric social workers, psychiatric nurses, there are the other mental health professionals. They are even much lower than this.
All of the COVID-19 induced anxiety and stress are taking a heavy toll, particularly on children and adolescents. In Kerala alone, 66 children of school-going age committed suicide between March and July alone. Children, mind you. And what is even more scary is the shape of things to come. The COVID-19 pandemic may in all likelihood be followed by a mental illness pandemic.
We are absolutely certain that there is going to be a pandemic of mental ill health soon after, unless we take urgent and active measures. So if that is taken by giving actual real priority to mental health problems, making early diagnosis, early detection of conditions like depression and anxiety, we will be able to save lives.
Unlike the COVID pandemic, a mental illness pandemic can be doubly crippling, affecting the economic and social sectors simultaneously. A study of the World Health Organization in 2019 had estimated that depression and anxiety disorders cost the global economy $1 trillion per annum. The COVID-induced increases in anxiety, stress and depression are already showing up in another area, diabetes, where India is poised to overtake China in 2025. COVID-time pharmaceutical industry statistics show that sales of all diabetes-related consumables like insulin pumps, glucose meters, CGMs or continuous glucose monitoring systems, insulin pens, insulin tablets and insulin strips have all gone through the roof. Most stunning is the increase in sales of glucometers in the Indian market, an equipment that helps diabetes patients to measure their blood glucose levels themselves. Roche and Johnson & Johnson, the two leaders in the branded segment for glucometers in India, have seen their sales break all past records. The glucometer market in India is now poised to grow from the present level of 5 billion rupees per annum to 10 billion rupees per annum in the near future, as India heads towards being the diabetes capital of the world by 2025. If COVID-19 has provided one good turn, it is to bring more focus on the mental health sector. Manoj Chandran, CEO of the Bengaluru-based White Swan Foundation for Mental Health, says, influencers must use this opportunity to see their roles and address challenges in this sector.
The current pandemic has certainly created more visibility for mental health care issues. Now it is important for the influencers, for the decision makers in every small modules of our society to see their role in it, so that they are able to address those challenges, those hurdles, those various issues that people face in reaching out and seeking services, demanding services and getting access to services, both timely and good quality.
Earlier this month, we marked the World Mental Health Day, a topic extremely crucial for India. 700 million under the age of 27 years, 260 million of them in educational institutions. Statistics that are absolutely appetizing for any nation with demographic dividend written all over them. Now is the time for India to ensure that the DD does not turn into depression and diabetes. We cannot afford their costs, both economic and social. Like singer Selena Gomez said, if you're broken, you don't have to stay broken.
But if you are broken, you do not have to stay broken.
There's no reason for India to stay broken, either depressed or diabetic. Thank you.